So today we're going to talk about blending fillers, okay, for master aesthetic artwork. Okay, blending fillers for master aesthetic artwork. So what that means is that we're going to be showing people how to blend the radius and bilateral, okay, to use that specific area of the face. All right. So to produce master artwork, no filler fits for everybody. Okay, no thickness fits it for everyone. For example, for a young person with thick skin, if you want to use radius, you could use in its original form, which is very thick, high lifting, a lot of lifting power. So if I was doing junk hair, let's just focus on 3 areas. If we want to improve here and we want to put the radius here, vector 1 and vector 4 or 5 here, I want to put the radius in this way to lift this whole thing. For her, young person, thick skin, lots of good tissue, you will either no blend, which is high G prime product. This is a very high G prime product. You want something thick, makes sense, right? Instead of thin. Thick product goes in here, threaded to lift. Imagine if you use a very thin product, like we blend it to like liquidy, it will not lift. I hope that makes sense. For people generally over 45, 50, skins is thinner, right? Less volume. If I were to put this thick product without blending it or softening it, what would happen? It would create a bump, a swelling. It would not look natural. Okay, we call it undulation, like roller coaster bump. So it makes sense for people who's older, you would blend this down, right? Again, I would create the lift to improve this area by ejecting the radius this way. Same technique, sorry. Okay, but I would definitely blend it. So there are 3 kinds of consistency, or we call it a G prime. G prime means high G prime, high lifting. This is a high G prime product. You either don't blend it, okay? That means it's very thick or thin. Thick. So you could lift, right? Or you could blend it with 0.5 cc of Lido, okay? To make it medium thick. Or you could blend it down very soft, not thick at all. Very thin, very soft. Instead of 0.5 cc here, you do the same thing, 0.5 cc with lidocaine, which is kind of watery and aesthetic. In this part, you add additional 0.5 cc of bacteriostatic water to really blend it down. Okay, so we have 3 options now. For young people, thick tissue, you could just go straight, okay? Very thick, very strong pulling. For medium thickness, you could put 0.5 cc. For very thin, very soft, thin skin patient people who are mostly over 50, you could blend it with 1 cc. I hope that makes sense. So if you guys, everybody come over here and let the camera focus on this area. So we had talked about no blend, straight, for what kind of patients?
Young patients.
This means that it's very thin or thick?
Thick.
Okay, very good, guys. All right, let's go to the medium one, which we put 0.5 cc of lidocaine. So we use 1% lidocaine, and this is medium thickness, so you just draw 0.5 cc, and then you use, okay? Versus if you want to blend very soft, you not only use 0.5 cc of this, you what? Add 0.5 cc of this. We talked about the blending has to do with, when you're assessing, has to do with age, right? If you're over, below 50, you're really young with a lot of tissue, you do the what? The thick or the thin?
Thick.
Okay. Now the second part is anatomical location, okay? For example, to improve this, we put the filler here to lift. But the third location, you could put fillers is here. You enter here and you could thread it up this way. Okay? And anytime you thread in this on the side, you want it at least the medium thickness or really thin product, like here. So you do want to blend it down to 0.5 with 0.5 or with what? The third option, the thin one, which is 1 cc, right? So often I will ask Tina we usually use 2 vials. I was, okay, let's do 1 vial without blend and 1 vial with blend. Okay, so to create master artwork, you want to know it's all about the depth. All the plastic surgery, all the aesthetic journals talk about, it's all about the thickness when you assess and when you inject. So if you assess this area, and from Rosa's, you can immediately tell, here's the skin, here's the muscle, and in the middle is the fat. The young person that we just saw, Rosa, she has this much fat. So you could put thick filler and it will be fine. On here, you could feel skin, muscle. Her fat is this little. So if you put thick product, it'll bump up. Undulation, they call it, like these little bumps. Therefore, for her case, when we're doing the vector in this region, you want to use either 0.5 medium blend or maximal blend. It's a very soft product. Okay, at the same time, it'll give you some lifting. Let's say if you were to take care of Sarah, very beautiful, and you want to treat her in this region, okay? She's young, but she has just naturally less. If you guys could come and just touch this area, yeah, if you want to. Anyway, so for her, even though that's why it's an art. There's no like, these are just guidelines. If you assess her skin and her muscle. So what is her fat layer? Is it this thick or this thin?
Thin.
She has thin. So would you choose the blend of 0.5 cc, which give you medium thickness, or very thin product for her? Yeah, I would do 1.0 blend for this area, okay? But when you're talking about here, you need something thicker to lift. So I would do 0.5, okay? So there's 3 things here. Okay. You first always pick up the one that's pre-filled or the one with the Lido or the liquid, and you put this lower lock on. The most critical part is right here. You guys see there's a lot of empty space. We have to kind of fill it up, pre-fill it, to push out the air. Okay, if the air remains in there, it's not gonna harm the patient. It's just that it's gonna be a lot of air in there. It looks like champagne, and it's sometimes harder to inject, okay? So that's really important. And then you take the radius and you kind of just push. Okay, look at this, okay? Ready, say go. Look, it's really pretty. Okay, and then we remove it. Once again, you kind of push out all the spaces and fill it with product, and you take an empty 5 cc syringe, and then you put it together, and you just kind of, the key here is 10 times, okay? You want to blend it. So I'm gonna start. So this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now remove this. Again, make sure the air is evacuated. And then you put it back into the syringe that came with the company and just slowly fill it. I prefer not to fill it to the top. I prefer just fill it to 1. Right there, 1. and then you kind of leave it here. The reason we don't want to fill it to the top because some people's hands are just a little bit smaller. It's hard, but here it's a lot easier to inject with one because you could hold it. So you got your 1 cc, and you got the rest of your product in here, ready to go. Okay, so I'm continuing producing blending for master artwork in aesthetics. So please go ahead and like and comment on our videos and subscribe. So what do you do with the rest, right? Of course, these products are expensive. You take a 1 cc syringe, and Rosa's gonna give me another one from me. You go ahead and pre-fill it. Here, and again, you just kind of fill it up a little bit. And there you go. So for one vial of radius, you have the product here, and you have the product here. So this equals to 1, okay? And then you bring this to the injector. So that's how you blend it. Any question? We're good? Okay, I'm gonna let some of you try one, okay? All right.
Yeah.
Wait, 1 trip is 1?
I mean,
And then round
definitely in there.
Round trip.
So that's one.
Let's say we transfer a tiny bit, and let's say someone is allergic to it, but there's so little,
I did for 24.
and no one is allergic to it. Yeah.
You want to go to the bottom of where the black is.
Okay.
Right there?
Yeah,
1.0.
Remember the first one?